Hey guys, Dr. Childs here. Today we're going to be talking about thyroid medications that are still working in 2020. I'm going to be talking about what thyroid medications I'm recommending right now, what thyroid medications I'm getting good results with, and we're going to go over those. If you don't know me, I'm Dr. Childs. I'm an internist. I specialize in treating thyroid problems, helping people with hormone imbalances, and of course, helping people lose weight. But let's get into our topic today, which has to do with thyroid medications. Let me grab my whiteboard. So here's the issue. We have had a number of changes to thyroid medications over the past, I would say really starting in like 2016. And then the last 4 years, we've seen a decline in medications that used to work really well. And so a lot of people have been asking me, what are you using? What are you seeing good results with? So that's what I'm talking about today. I'm going to talk a little bit more about the problems that we have with certain medications down below, but I want to tell you what I'm using right now. So one of the first, and I would say, when I'm seeing patients, this isn't true for all thyroid patients, but I would say about, 60 to 70% of the time, I'm recommending one of these 2 or 3. And there are some nuances on the tail ends of the spectrum here, but for most people, this works quite well. And that is the combination of Thyroid with sustained release T3. So Thyroid, if you don't know, is a T4 only thyroid medication, and it is kind of unique because it has so few inactive fillers. In fact, it's probably one of the cleanest thyroid medications out on the market right now, and I'll talk about why that is the case in a little bit here. So I'm using a T4 medication plus sustained release T3, which is a T3 medication that you get from a compounding pharmacy. And again, I'm using the sustained release T3 because that is another cleaner version of Cytomel or liothyronine, which is what we're going to talk about next. So I find a lot of people doing very, very, very well on this combination of T4 plus T3. And I'll talk about some of the benefits of this in a minute. I'm just telling you what I'm having good success with. The second combination that you can consider is Thyroid plus liothyronine or Cytomel. So liothyronine and Cytomel are other prescription medications. They're T3 thyroid medications, and they are what would be considered immediate release thyroid medications. So sustained release T3 is exactly what it sounds like. It's sustained release. If you take it, it takes your body, a couple hours to absorb, even throughout the remainder of the day. It kind of gets a slow absorption throughout the day. Whereas immediate release versions of T3, such as liothyronine or Cytomel, these are absorbed right away, probably within an hour or two. And then they're flushed into your bloodstream. So the same thing, the same T4-based medication, which is T4, plus the immediate release version of sustained release T3. So that would be liothyronine and or Cytomel. Then the third option, which is, I'm saying really it's optional. This used to actually be one of my more favorite combinations until the problems with NDT that have come about in the last couple of years, which we'll talk about in a minute. You can still use NDT with T3, either IR or SR. So you can use NDT such as Armour. Let me give you an example. So we could use Armour Thyroid, 1 grain plus, let's say 25 micrograms of either SRT3 or maybe Cytomel. So something like that would work well if Armour Thyroid or NP Thyroid or one of those is actually working for you. But there's a lot of people who are having issues with these types of NDTs, so that's why I don't put it as number 1 or number 2. But if you're somebody who can tolerate NDT, then it actually still can work for you. So this is really what I'm seeing the most success with. Now, I want to put a caveat here and say you don't have to necessarily use these, okay? Just because they're working for me doesn't mean that you have to use them in order to get results. That's not true. You can get results. I mean, I still have people on the tail ends of the spectrum. Remember, this is only 60%. I have some people using T4 only. I rarely ever prescribe levothyroxine or Synthroid, but I do have some people on Synthroid and they're doing well. I have some people on Thyroid only and they're doing well. And on the flip side, I have some people on sustained release T3 only that are doing well and liothyronine only that are doing well. But I would say 60 to 70% of people do very well on this combination. So let me talk about why it is that I like this combination and why are we not recommending other things like NDT, Nature Thyroid, WP Thyroid, Armour Thyroid, etc. So one of the first benefits is that when you take individual T4 and T3 thyroid medications, you have the ability to titrate the individual doses of T3 and T4. So what do I mean by that? So if you take Armour Thyroid, let's just say you're only taking Armour Thyroid, and Armour Thyroid, this applies to any medication that is in the NDT family of medications. Every single grain, which is a unit of measurement for how you dose this, has the same amount of T3 and T4. So it's 38 micrograms of T4 and 9 micrograms of T3. But what if you are somebody who is too sensitive to the 9 micrograms? Or on the flip side, what if you need more than that? Well, if you take another grain, you've increased the T4 and the T3 at the same rate. So you can't titrate or individually change the T4 and the T3 dose if you're using something just like NDT. But you can do that if you're using Tirosint. You can just say you're on 50 mics of Tirosint and 25 mics of T3. And you say, well, I need more T3. Fine, you can keep the T4 constant and you could increase the T3 or vice versa. So you have the ability to really tweak your dose. And individually, at the individual level, each person is going to need a different amount of T3 and a different amount of T4 in order to feel better. So this is actually a really important thing. You could do this with compounded thyroid medications. You could do this with, you don't have to necessarily do this with Tirosint only. You can do this with levothyroxine or Synthroid, Cytomel, liothyronine, etc. But one of the great benefits is you have that ability to titrate those. So that would be benefit number one. Benefit number two is that the combinations I'm recommending up here, I would say are actually cleaner now. Well, they're among the cleanest thyroid medications available on the market. It used to be the case that I would say WP Thyroid was probably one of the more cleaner thyroid medications on the market. I think it had the fewest inactive ingredients for NDT formulations of thyroid medication, but that's not really the case anymore ever since lactose has been added to it. And we'll talk about that when we talk about NDT in just a minute. You probably can't see that, but we'll get to it in a second. So nowadays, the cleaner version, the cleanest version of T4 is definitely Tirosint or Tirosint Sol. And if you get a sustained release version of T3 from your compounding pharmacy, you can control the inactive ingredients better than you can if you were to get liothyronine, or I'm sorry, not liothyronine, but levothyroxine or Synthroid from the regular pharmacy. You cannot control what they are putting in it, but you can if you get it from a compounded pharmacy. You can ask them what's in it. The doctor can make special requests for what should be put in it or what should be taken out. So you really have a lot more control over what is in the inactive ingredients in your thyroid medication. And that actually makes a big difference, believe it or not. It could be the difference between absorbing it or not, or also having side effects or reactions to those fillers. So the fewer the ingredients, the better. And like I said, it used to be WP Thyroid. Tirosint's always been clean, but it used to be WP Thyroid that was the cleaner version, but that's not the case anymore. So I just can't in good conscience make that recommendation, especially now that it has lactose ever since 2018. So that's number two. They are definitely among the cleanest thyroid medications available. Then number three would be that they are highly absorbable. So Tirosint is a great, really highly absorbable medication because it has so few inactive ingredients. And actually we have studies showing that individuals who take Tirosint, they can actually take it with food, they can take it with coffee, they can take it with supplements, except for iron and calcium. And it won't interfere with the absorption, which is not true of levothyroxine. It's not even true of liothyronine or Cytomel. It's not true of NDT. You have to take those medications away from food and away from drink if you want to make sure they get into your body. But Tirosint is not the same way, and that's because it gets rapidly absorbed into your body. So I really like the fact that it's highly absorbable and that you don't have to be as vigilant about when you're taking it or what you're taking around it. So it gives you a little more freedom as a thyroid patient. And I think that's important for a lot of people, especially people that are busy, they have jobs. You know, it's not always possible to wake up in the morning, first thing in the morning, take your thyroid medication, then wait an hour and eat food, and then wait another 3 hours and take your supplements. You know, that can get a little bit difficult depending on your schedule, especially if you have to go to work. So that's another benefit. And then number four, people will probably see this and say, why aren't you recommending more NDT? I used to. I wish I could. I would love to. But Armour Thyroid has had issues since 2016. In 2018, we have issues where they added lactose into the NDT diluent, and that affected WP Thyroid and Nature Thyroid, so both of those have lactose. And then we have a reformulation of NP Thyroid, and that has caused a lot of issues for patients. So we have all four of the main types of NDT thyroid medications that people are experiencing problems with due to reformulations, additions of inactive ingredients, and so on. So it's really hard to say that NDT is the preferred medication right now due to all those problems. And a lot of NDT patients are struggling right now because what used to work for them is not working for them anymore. But what I have found is that switching people to this combination has been working really well. I also want to point out that just because I'm giving this information doesn't mean that NDT is going to fail for you. It's very possible that you could do well on NP thyroid and have lots of people who still do well. Even though there have been changes, doesn't guarantee that they will negatively affect you. So I don't want you to think that. I don't want you to believe that because it's not true. So I still think it's worth trying NDT, which is why I put it here as option number 3. It's still worth giving it a shot to see if it works in your body. If it doesn't, no problem. You have other options. And these can be tweaked around. You can try liothyronine, you can try Cytomel, you can try sustained release T3. You have at least 3 different options plus the T4 option. And again, T4 just because a lot of people do well on it or need at least a little bit. So I still think it's worth looking into these options. You don't necessarily have to use them, but play around with them and figure out what works for you. So this is just what's working for me, but I want to hear from you guys. What are you using right now? Is it working for you? For instance, if you've been on NDT and it's no longer working for you, let me know. I want to hear your story. It's helpful for other thyroid patients to get this sort of information as well. And if you haven't already, don't forget to download my free PDF thyroid resources. You can get those in the comment section or the link description below. I have a ton of free resources that are all designed to help thyroid patients, and I think you'll find these really helpful if you like this sort of information. So go download those, leave your questions below, and otherwise I will see you guys in the next one.